So, good morning ma'am. I am Ashley Joy Albaran from BSN 1B. And today I am going to demonstrate how to obtain blood pressure. Before we start, first, what is blood pressure? Blood pressure is the pressure that is exerted on the wall of the arteries when the left ventricle of the heart pushes blood into the aorta. Next is, what are the purposes of blood pressure? First, to measure the systolic, diastolic, and pulse pressure. Second, to determine the certain physiologic and changes that may occur. Third, to determine the pumping action of the heart. Fourth, to aid in diagnosis of certain disease related to cardiovascular system. And lastly, to evaluate the general condition of the patient. There are also special considerations in obtaining blood pressure that we have to remember. First, keep patient physically and emotionally rested before taking the blood pressure. Second, position the client in sitting or supine position. Position the arm at the level of the heart, and the palm of the hand facing up the left arm is preferably used because it is nearer to the heart. Third, apply the BP cup snugly above the antecubital space. Fourth, determine the palpatory BP before auscultatory BP to prevent auscultatory cough. Fifth, use the bell of the stethoscope since the blood pressure wants a low frequency sound. 6. Inflate and deflate BP cup slowly 2 to 3 millimeters of mercury at a time. 7. For repeated reading, wait 1 to 2 minutes before taking the blood pressure in the same arm, in the same position and time. 8. The sound during BP taking is Korotkoff sound, first sound. 9. Take the blood pressure reading as quickly as possible to prevent venous congestion. 10. Allow 20 to 30 seconds for venous congestion to normal if repeated reading is necessary. 11. Report promptly to the physician or head nurse any significant changes in the blood pressure reading. And lastly, size of cup should be appropriate in the size of the patient's arm. So now we will now proceed on doing the procedure by assessing first the client's physical condition. You can see by inspecting the client that his breath is normal and doing fine. But we can also say that even if we see the client's doing fine, we may not know that he is in pain somewhere. That's why assessing the client's physical condition is important. Next is assess for factors that affect blood pressure. Have you been drinking alcohol, sir?
No.
Okay, thank you. After that, determine the client's baseline blood pressure. May I know your last blood pressure, sir?
Hindi pa po ako nakakapag-ito.
Okay, sir, got it. To proceed on obtaining blood pressure, we need to wash our hands first. I will put some alcohol in my hands to disinfect and avoid contamination between clients. Next is gather all the equipments that are needed. I have stethoscope, sphygmomanometer, alcohol, paper, and pen. After that, identify the client and explain the procedure. May I know your name, sir?
Desnaide Albaran.
And your birthday, please?
June po, November 11.
Okay, sir, thank you. So today, I am going to take your blood pressure. Is that okay with you, sir? Place the client in a comfortable position, lying or sitting, and place the arm at the level of the heart. Next is can you please hold this for me? Place the cup at the center, observing at least 1 to 2 inches above the inner aspect of the brachial artery. Wrap the cup around the arm smoothly and snugly. After that, feel the pulse over the inner aspect of the elbow with the use of the fingertips. And then place the stethoscope earpiece pump. Palpate the brachial artery, close valve, and compress valve to inflate cuff to 30 millimeters of mercury. After reaching the max of compressing the cuff, release the tone on the cuff slowly so that the pressure goes down at the rate of 2 to 3 millimeters of mercury per second. Listen to the sound, and the first sound you will hear is the systolic. Continue to release the air evenly and slowly. The last soft muffling sound is the diastolic pressure. Deflate the cuff rapidly and completely after the final sound has disappeared. After that, clean and store the equipment. Then wash our hands again. Next is evaluate the nature of blood pressure. Okay, sir, your blood pressure is 115/80. It is normal. Do you feel okay? And then the last thing that we are going to do is to record the result taken that I have done a while ago. And that would be all for obtaining blood pressure. Thank you.